There is not a liberal America and a conservative America. There is the United States of America.
A new vision will govern our land.
Our job is not to divide. Our job is to bring people together.
By the people, for the people, and of the people.
Our youth has power.
Border Talks is a video podcast by students in the TAMIU Political Science Association dedicated to exploring the political impact of ever-changing current topics, with an understanding that even the most political can become personal matters. We aim to explore how the issues ranging from the most seemingly insignificant, absurd, or serious subject matters can affect our border town through a nonpartisan and student-focused perspective. So hi everyone, welcome to another episode of Border Talks. As per usual, my name is Cecy and I'm your host, and I'm a TAMIU student majoring in political science and sociology. And today I'm joined here by my fellow PSA members, and I'll go ahead and let you guys introduce yourselves. We can go ahead and start with Marco, followed by Carlos, and then Mauro.
Okay, hello, my name is Mauro Castillo, and I'm also a member of PSI from TAMIU. And my major is political science.
Okay, awesome.
Hi, my name is Carlos. I'm a nursing major at TAMIU, and I'm also a member of PSA.
Hi, everyone. My name is Mauro Flores. I'm a freshman at TAMIU. I'm a member of PSA too, and I'm majoring in communications with minor in political science.
Okay, super great. And I'm super excited to have you all here because you all have very different but also similar experiences. And I'm really interested in talking about today's topic, which is the world's topic, COVID-19, coronavirus, the Rona, whatever you want to call her. So now that PSA actually wanted to have a Border Talks episode once when the pandemic started, but we were like, no, like everyone's talking about it and like it'll probably hopefully go away soon. Clearly it hasn't. Now we're almost going to go to school and things are getting scary. So to start us off, I just wanted to talk about what we're looking at right now, where we're at with the pandemic right now, which unfortunately is that the city of Laredo is going higher and higher exponentially with the number of positive active cases that we have. I believe as of today, we're at about 2,500 positive active cases, and our hospitals are getting full. So these are all very, very scary things. And the first thing I wanted to address is what the city of Laredo is trying to do as of right now to lower and stabilize those numbers. So what they did just this past Wednesday was that they're trying to make it so that no more public gatherings are allowed, no more eating inside of public restaurants, only like drive-through, curbside. Basically, it seems like they want to go back to the original lockdown that we had when Governor Abbott gave the cities, pretty much every city, like the ability to be able to say what happens with their city. As of right now, though, because Governor Abbott hasn't given that like power back, basically, we're at the point where the city has to go through the governor and get those exceptions. So what they have gotten approved is that just recently they mentioned that everyone has to wear a mask, and if you don't, there's a $2,000 fine. So basically that's where we're at. And I just wanted to hear individually what you guys think. If you think that these are good measures, if you think that we should go into a lockdown. And then I specifically want to ask you guys about like different experiences you've had. So we can start with, do you think this is a good idea? Do you think there should be more done? And then we'll go
on. So like, it's really crazy with everything that's going on, right? Like, I think it's kind of ridiculous that the cities have to go through the governor to get access or like the ability to like close restaurants and to have the face masks and everything. But it's insane to me still, like even with the $2,000 fine, which I think is pretty steep, like you'll go to HEB and you will still see people not wearing the mask, or if they do wear the mask, they don't wear it properly. They don't put it over their nose. And it's terrible. Like, there's still things being figured out with COVID-19 and transmission. There's like droplet transmission, but it's also known that it's like close contact and everything. So so long as people keep their distance, wash hands, and use the mask. And like, also another thing that I see that really upsets me is that when people have to cough or sneeze, they literally take their mask off. I've seen that happen
God, yes.
in grocery stores. I'm like, that's the whole purpose of that mask, so that you can cough or sneeze into it. Like, that is the purpose. But yeah, that's what I just think it's insane.
Yeah.
The lack of compliance.
For sure. And then Mauro and Marco, just if y'all have anything like just to generally add, and then we'll go more specifically into everyone's experience so far.
I definitely agree that I feel like it's if you ask the governor to approve these things, it's going to take even more longer for them to be instated in our city. And it's going to be like, the cases are just getting bigger and bigger, I guess, whatever, through every day. And the longer we wait for the governor to approve it, the higher the cases are getting. So I definitely do think that power should just be given to us, like, automatically, especially during an actual pandemic.
I agree with both points about how a lot of people do wear a mask, but they don't wear it properly. So that gives them, that affects more like giving fake confidence to a lot of people around them too. So that also affects how the virus spreads faster. But I also think that we have to put more strict regulations on the lockdown. I think like as you mentioned, when the city, before the governor's order to reopen the state, I think the city was doing okay in trying to flatten the curve. And I think the science was already showing that it was a very rushed opening. It was not a great idea to open so early. And like, I understand that a lot of us still have to go to work, even with the pandemics when they open. So I understand the economic side of it, but we should be more, I think the government officials should have been more considerate into how it was going to affect everyone's life, not only like the working class or like the people that need money or are getting money out of it. Yeah.
Right, absolutely, I agree. And there's been a lot of people who've been critiquing, like, well, is there people making money off of a pandemic? Like, that should not be a thing. But I really like that you mentioned that you think that the city was doing a good job prior to Governor Abbott saying that we have to, or making it so that Texas had to reopen, because if we did, like, at the time, the difference between how Laredo was doing versus San Antonio, of course, like, San Antonio is a way bigger city, but we did definitely see a difference in that Laredo we even came out on Time magazine because we were one of the first, if not the first cities to make it so that there's a fine if you don't wear a mask. And that was, at the time, it seemed like a crazy thing, but we saw that it really did help our city. And if you look at the numbers, our numbers were going down, and it wasn't until around the time that Governor Abbott made it so that the state started to reopen that, like you mentioned, Marco, there was what seems to be this false confidence in that we weren't going to be affected, and like we possibly got too comfortable with this idea of being in like a pandemic. But now that you guys mentioned all this, I think what I'm getting is that we're all feeling that there should be more done. And so, Marco, I know you have gotten tested for the COVID. So I just wanted to ask you, like, what your experience was with that, and we'll go from there.
Well, I got tested because someone that had contact with me had contact with a positive person. And the way it went is I made an appointment through an app online. Then the day of my appointment, I went, but it was a drive-through checkup. So when I got there, I had to call the clinic and let them know I was already there and just follow their instructions. and then they just take your information, a very basic info. But then the swabs hurt a lot. Well, in my experience, it really did hurt. I thought I was thinking to myself like, I'm not even gonna flinch. Just gonna be strength through it. I'm not even gonna feel it. You feel it, yeah, that's right. All those videos you see of people like crying and stuff, they're not exaggerating. They did the first one, it hurt, but then they took it out, and the second one, it started bleeding. So that wasn't fun either. But overall, other than the pain, it was very efficient, I would say. It was very fast, didn't take more than 10 minutes. But on the other side, I haven't gotten the results still, and it's been almost 2 weeks since I did the test.
Wow, and you're still asymptomatic, like no, nothing.
Yeah, I'm still asymptomatic. I'm hoping that I'm negative, and it seems that way. But I mean, it's still a lot of time. Like for example, in my case, in some cases, people can't go back to work until they get a negative result from the test. So it also stops a lot of people from working. So I think maybe something has to be done to try to make them more efficient. But again, I also understand it is a pandemic. It is a crisis. We were not ready to this extent to treat that many people. But overall testing, I mean, it's necessary. It's a necessary evil or pain, I guess.
Yeah, I think for sure. And it's scary that you had to go through that. And Carlos, I know you have also like had people that you know that have gotten tested. And so Marco, when you got tested, there was still free testing available as of right now. I know Carlos, you were looking into the tests and you said there was nothing that was free as of right now.
Yeah, so I don't have insurance. So if I want to get tested, I know you have to pay 200 or 225. And the city of Laredo did post a bunch of places where you can go get tested, but it's like if you have insurance, obviously it'll come out to really cheap, like $20. But a lot of these places too, you require a prior screening, and you kind of like you don't need an appointment, but like it's a very troublesome like process to go and get tested, especially with the resources that we have right now, because we weren't prepared for this. Because I remember in my clinical rotation in February, I was in the hospital. I was at LMC, and they were already aware of COVID. But I remember asking one of the nurses, I was like, "Oh, so are y'all testing for COVID at all?" And then he was talking about, he's like, "Yeah, so what we do is we screen them. We ask them a couple questions. Have they been out of the country? Have they felt any flu-like symptoms within the past 6 weeks?" He's like, and then basically, if we suspect COVID, we'll go ahead and call the city of Laredo, and they'll take over that. And I thought, wow, that's insane! Like how slow we were on testing to now, where there's like a lack of testing, and it's really terrible because if you're able to test more, you can do more contact tracing and find a way to reduce the transmission. Because right now, it's skyrocketing.
Right, and I think something really alarming that I just saw today was that KGNS had an interview with a biophysicist doing research in Berlin, Germany. And he actually came up with a model that was showing that following the numbers that Laredo has been seeing, that our cases around September should be 20,000, and that's our active cases, which is about like 10% of the population is what they mentioned in the interview. And he says that he probably wouldn't expect to see those numbers go down until probably around October. And considering that we're all students of TAMIU and we're all supposed to be going back to class soon, this is all super scary. And I want to ask you, Mauro, how this has all been affecting you. I know you're about to be a freshman at TAMIU. How has like TAMIU, and what instructions or just feedback have you heard like as a freshman in TAMIU? I know you have to like go to orientations, and all of those things have been changed to mostly online. So I want to hear your experience with that.
Well, orientation or adjusted camp was Monday and Tuesday. I think that TAMIU kind of just try to make it as fun as possible being online, but it still like wasn't the same, I think. But with class, I think that obviously this new semester, I don't think it's gonna be the same as any other semester. I think the events that like happened in campus are not gonna happen most likely because there's a lot of people involved, which is sad, I guess. But I think that's necessary because the more people that are on campus, especially like let's say during the Halloween fest or whatever, then the more possibility of being transmitted and stuff. I think that they were talking about doing like the flex thing where you can either do some classes online or some classes in person. What I am considering is doing is like going to campus for like the necessary classes and then just take like the ones that aren't necessary online to like, I guess, not be on campus that much, especially when there's a lot of students. But yeah, I think this year is going to be very different. And as much as I want to like participate and everything, my health and the health of my family comes first. So I'm just taking that into consideration.
And I'm glad you said that, and I hope that most people are thinking that way, because it's definitely important to consider the health of ourselves, our families, and even our community. We hopefully don't want to get to those 20,000 active cases in September. So hopefully that's not going to happen. And on the topic of TAMIU recently sent out a letter or an email saying that they will be providing free testing for students, which I think is a great move, and I'm really glad to hear that. However, we still don't know too much of the details on how that's going to work. The only thing that I had found was that they're going to do it via like an online registration, but there's still more to come from that. And Mauro, you also mentioned the flex classes, and I think what you mentioned is what I imagine most people are going to do. I'm still unsure what I'm planning on doing, because ideally I know myself, and I think everyone can agree here that like I learn better in person. When we switched over in spring to the online classes, even when I had like the Zoom or like the Blackboard meetings, I still like I would find myself not being able to focus, and if there was noise or if it seemed really difficult, especially when like you don't have a desk or like you have to stay in your room. So I wanted to ask you guys what you guys think about the flex classes, maybe what you'd like TAMIU to further explain or clarify in the future, and just what maybe you might be planning to do.
So I know for us, they already told us how our classes are going to work. As of right now, they're going to have all our lectures online. We will do everything like just like this past semester, how we went online. That's going to be completely online. And as for our clinical routines, I think it's still like up in the air. They don't think that the hospitals are going to let us go because like how bad COVID is, and hopefully it gets better so that we can do the actual rotations in the hospital. But as of right now, they're exploring they are doing clinicals with home health services. So it's the nurses that go to the houses and stuff, and that's how we'll be fulfilling those hours.
Well, that is scary, especially since like you're graduating in spring. You're supposed to go into the health field already, probably in January. So
yeah,
scary to think about all this. And I'm glad that TAMIU has been, or at least the School of Nursing has been a little bit more clear with you all. But Marco, is there anything that, like how you feel about flex classes, maybe what you think that TAMIU should clarify in the future?
Yeah, I'm still not completely sure how they're gonna work. Like the idea I have of them, what little I've read of them, I thought it was gonna be like they're gonna be given in both formats, so you have the option to choose whichever is more convenient or you feel safer with. But I think if they're like that, and if they will allow some students to go back to campus, they have to be really serious about keeping the guidelines of safety around campus inside of the classrooms. And also there has to be a limit on how many students can go in person. Like there have to be more like pre-registration for like which days you want to go, so like you have a seat insured and stuff like that. But overall, I think it is a good idea for, because like you said, I'm sure some students find it extremely difficult to learn online.
Mm-hmm.
I think I saw a lot of friends and people I know that are going to university expressing their disappointment with how online classes are, especially when you're forced into them and stuff like that. So I see the good in giving the option and making it available, but it's also, they have to reiterate or be aware that it's still a health risk for like yourself, your family, and like it's still there. Like the virus is still there. Yeah.
Absolutely. And actually, the Trump administration is claiming that science is getting in the way of opening schools, which I agree with, but I don't think we agree for the same reasons. So parents in Virginia went online only, and I want to ask you guys if you think that we should follow. I know that TAMIU is doing flex classes for probably most of us, but I wanted to ask if you guys think that it would be better to just keep it online, or if you think flex classes seems like the best idea at this time.
Yeah, so I think like the K through 12 or the K through 12 grades, like I feel like they should be online just because, you know, when I was in high school, like I remember passing periods and how congested the hallways would get. And like literally you're shoulder to shoulder with people, and like how do you're obviously going to catch something, especially with this disease that's so easily transmitted. So I definitely think the K through 12 should be online. As for like TAMIU and, you know, all of their higher education, um, I think I like the idea of flex classes because in college, like you really need to focus on what you're studying. And so you need to do things that are conducive to your learning experience, which is being there in person and actually participating in the lecture, right? So I like the idea of flex classes, but yeah, obviously there has to be um, some sort of guidelines there where like there's only a limited amount of people in the classroom and social distancing, and of course wearing a mask.
Mm-hmm. Right. And Mauro, you're, like I mentioned, you're about to be a freshman, and I'm sure like you're not getting the typical like, OMG, I'm a freshman, I'm free, I'm in college, like I'm grown, as most of us, I assume all of us did get. So I want to just get your perspective on like being that it's kind of like ruined your experience in like going to like university for your first semester and year, and just like how you feel, how you've heard like other like graduating seniors feel, just what you've been feeling.
Well, like obviously the year is not going to be the same. I think that, as like I said, as much as I would want to, you know, be very involved in school and participate like in all the events, my health and the health of my family comes first. And there's always next semester, there's always next year. The events are not going to go away. When obviously all of this started around March, us seniors in high school and now graduates, we didn't know that was going to be like our last day, you know, and we did lose a lot of like events. Like we didn't have a prom, we didn't have our scholarship night, our senior breakfast, everything. But I think we did what we could with what we were given. You know, we had our graduation at the Shirley Field. You know, it was not the same, but it was something. So I think that I feel like what we're going through, we're not in the position to ask for a lot. You know, we're not in the position to just be like, oh, I want this, I want it this way. No, it's like you're getting what you're getting somehow, and just be grateful for it. Like I was grateful that we had at least a graduation outside, you know. So I think that not just being grateful for what we're gonna have, like for flex classes, I'm sort of grateful that at least maybe I can have 2 in-person classes at least, and the rest can just be online and it doesn't really matter. But
Yeah, and I think that's a really like good and nice perspective to to have, and I'm glad that you're thinking this way, because ultimately it's for the greater good of everybody. So it's really nice to hear that you're feeling that way. And I think for me, when I think about like flex classes and how TAMIU has been dealing with this, the biggest concern that I'm personally having is that the idea that I don't know about y'all, but I looked at my fall semester and it seems like we're going to be charged what a typical normal semester looks like. There's rec fees, there's athletic fees, and it's my understanding the rec's probably not going to be open. Athletic events are probably not going to be happening anyways. And so originally TAMIU had been justifying those flex classes in that the Trump administration, and ICE specifically, was going to deport students who were or most of our international students, and internationals in the name of our university. So I think it was good that in the beginning that we had flex classes because of that. But recently, since that has been rescinded, although I would ideally like to keep flex classes, because as we've all mentioned, there's good and bad, but there's good reasons to keep the flex classes. I think that keeping the tuition the same as a typical semester definitely doesn't seem fair. And I guess I just want to know if you guys have any thoughts on that, or if you've seen that maybe your tuition has been lowered, or if it's the same.
Well, I know, like, for me, like, especially with the school of nursing, they already told us we're going online. It's upsetting that, like, I am going to be charged exactly the same when I'm basically taking online courses. And even then, like, my clinical experiences or my clinical rotation sites are going to be like subpar. I'm not going to be going to the hospital. I'm going to be in another setting, which is like, I understand like they're making do with the situation, but it's still not the experience you're supposed to get and that you definitely are paying for, especially considering like, you know, I have to take out loans to pay for my college and everything. And so it does rack up really quickly.
Right, for sure. And I'm sure we all agree, Mauro, you're a freshman, so I don't know how that's been going. And then Marco, were your fees looking the same? Do you feel that it's fair for TAMIU to be charging like rec or athletic or any other things like university services and stuff like that?
Like I haven't personally checked my fees, but again, I've seen that concern echoing in like a lot of the students for sure. That and of course, like if the rec is not gonna be available to use for the students, I understand maintenance still has to be done, but as there's gonna be less not damage but less use, so less maintenance will still be required. So I think the fees should change, definitely, at least in that aspect.
Yeah, for sure. And given that we are expecting for, or this recent report by this scientist about Laredo and the numbers that we're supposed to be seeing is saying that we're going to be getting higher, I think that makes it even more concerning, because most of us, or a lot of us, are considering to go at least in some time to go to school, or even to be in public places, or even a lot of us work too. So this is all very much a cause for concern. And so I know we briefly touched on it in the beginning, but I want to ask what you guys personally think is the best move at this point, or what you think that you would like for our city officials to be able to do. I know for me personally, I feel that although it would be very difficult as far as like the economy and things of that matter, I think it's important for us to put a big pause on reopening and on going back to school and all of these things. I think that it would be, for me, ideal that we only keep things curbside. Basically the lockdown that we had in the beginning, where maybe online classes for TAMIU, instead of having flex immediately available, I would personally prefer to see only online classes available in the beginning while we get the numbers going back down, since as of right now we're still seeing those numbers go up. and just basically to try to get the numbers down before we start doing flex classes and all of those things. So Mauro, you're a freshman, and I know you want to go to class, I'm sure. I mean, even I do. But what changes, or what do you think would be ideal as far as like what you think, like if you could wave your magic wand, what do you think the city should do?
I think the enforcing the mask is a good idea, because in the beginning our cases were low because of the fine that they had put. You know how it was like 1,200 or something.
Mm-hmm.
But I think TAMIU, with the whole flex thing, I think what they're trying to do is, I guess, accommodate everyone, because I know there's a big portion of students who do want to go back to school. So I think that that's a way for them to accommodate everyone. And also, you know, the president wanted to, like, I heard that he wanted to like cut funds and stuff if we weren't going to actual school. So I just think that the TAMIU should like really, really consider everyone and our health and our safety and stuff. As much as I obviously want to go to school, I think that also I would probably just be okay with full online classes if it comes to that when we go back to school. So.
Mm-hmm. And then Carlos, you're a nursing student, so maybe you could also offer us some insight on precautions you think fellow students at TAMIU should take if they are going to be choosing to attend these flex classes in person.
I think, first of all, the mask. That's the most important thing. And I think also if people are going to be using gloves, like rubber gloves, there's a proper way to use them, you know? So like if you're gonna use these gloves, you're gonna be touching all this stuff. Like you have to remember that these gloves have all those germs from everything you touch is on those gloves now. So if you go and touch your phone, you've now contaminated your phone, and then so you're at home now without these gloves, and now you're just touching your phone, and defeated the whole purpose of you even using gloves in the first place. So I think proper use of the gloves, which would be like using them for a one-time use and not contaminating whatever you're gonna be using on your own time. And also the social distancing. You know, I know it's hard to social distance like in college, especially like in the library and stuff. Like if you're studying with people, like it's really hard, like because you know, like you start talking and then like, oh, you look at their book or something like that. Like it becomes really difficult. But I think that's a necessary thing to prevent infection.
Mm-hmm. And then Marco, just anything you'd like to, again, magic wand, if you had your magic wand, what do you think would be ideal, or what do you think would be the best for TAMIU and maybe the city of Laredo to do in order to deal with this pandemic?
I think if our like only focus or main focus is the pandemic, as it should be, really, because it's lives. I think loss of life should be the greatest cost, to be honest.
Mm-hmm.
So online classes are the best way to reduce, I think, the spread of the infection of the virus. My bad. But also, as you mentioned, I think the city was doing really well when we first were enforcing the mask, the social distancing, the more strict entrance to the stores, like the stores counting how many people can go, and trying to keep guidelines in the stores themselves of like the 6 feet and how far apart they should be. But definitely taking it backwards and reopening the state, or well, in this case, the city, I think would help a lot. Because that shows I think when the reopening of the city shows our second spike in cases, and the trend hasn't gone down since. So I would suggest that closing the city back to before the opening of the state would really help. I think the cases lower.
Right, lockdown. And I know that there's a lot of people that probably don't want that. And I know I hated lockdown, like as just in general. And even right now, like we have curfew and I hate it so much because it's like 11 and I'm like, OMG, I'm gonna go get a snack at the gas station. And I can't do that because of this lockdown, well, not lockdown, the curfew, but I think that we're all pretty much in agreement that these are all necessary steps, and I'm glad to hear that for the most part, most of us, and it seems like most of the people that we're like that are in our circles also want to make sure that we're safe, and so hopefully things get resolved. This 20,000 prediction of the cases in September is hopefully not going to be a thing, but we'll see how all of this plays out. But I just want to thank you guys for joining me here today, and I just want to ask you if you have any final thoughts or any other things you'd like to say to TAMIU students or audience. And yeah, that's pretty much it.
Yeah, I think I just want to say, like, don't get confident. Don't be confident that just because we're young, or like because you see other people go out, or friends, or a lot of people our age. I'm pretty sure we have seen friends of ours like not really caring about curfew. Like, don't be confident that it can't happen to you, because we're all vulnerable to the virus. I think just keeping that in mind will really help us be more conscious about the damage we can really do, like spreading it.
For sure.
And to add to that, basically just keep in mind like who you're taking. If like as a younger person, like you probably will be okay from the virus, you know, but you are going to give it to people who may not be able to fight it off. And also you never know like what strain of the virus you're going to get. And, you know, just watch out for yourself and be a considerate person and understand like this kills people. It really does.
Right. And then Mauro?
Yeah, I think to agree with Carlos, I think we should just be more considerate of our health and others. If you can avoid going to like parties or whatever, I know we all want to party, but I think the health of our family comes first, and this virus just takes anyone and everyone. I was not that considerate at the beginning. Like right after my graduation, I know I went the next morning, I went to South Padre with my best friend, and no one wore masks like anywhere really. And I mean, thank God we were all okay, right? But I think that we just all have to be considerate as much as we want to like do whatever we want to do, like party.
Right. I think things are getting super serious, and on PSA's end, we want to do things like do more voter registration and bring more attention to upcoming elections, but all of those things are changing. And even though ideally we'd like to be at TAMIU, be on campus talking to y'all and having border talks in person, talking with y'all in real life, I think that, like you all mentioned, we need to be considerate. We need to take care of each other, take care of our community, and most importantly, to come together so that we are able to figure all of this out. Everyone keeps saying it, but these are unprecedented times, and hopefully, I'm sure that as this thing continues on, we're able to come together, and as a TAMIU community and Laredo itself, we're hopefully on our way to taking care of each other, and we'll see how the rest of this plays out. But I'm really thankful to have had each of y'all's thoughts and experiences on this podcast, and thank you guys so much for joining me. Thank you everyone who watched, and I hope everyone has a great day. Stay home, stay safe, wear your masks. And that's another episode of Border Talks.
Yeah, thank you. Have a great day.
Okay, bye guys. Thank you.
Bye.
Bye.